Thanks again for tuning in to another edition of the Chapters Health System COVID-19 Q&A. This week, we're going to focus a little bit on the spirituality side of the care that we offer. And joining me today is Charles Harkala. He's a spiritual care coordinator preceptor at Good Shepherd Hospice. How you doing today, Charles?
Pat, I think I'm doing fine.
Wonderful.
Real good.
Wonderful. Well, over the past few weeks, through these video Q&As, we've discussed how patient care, kind of on the medical side has changed due to the COVID-19 pandemic, but we haven't really touched on anything from the spiritual side. So what have you seen as some of the differences on how we've been caring for patients spiritually over the last month plus now?
Well, of course, everybody pretty much knows about this, and they carry maybe a little is not the right term, a lot of anxiety about this. And so spiritual care includes everything. And so our chaplains are greatly equipped, and they usually know most of their patients initially, whether it's with a teleconference call or via a visit. And that is decided by the family and patients, which they want. And so we adjust accordingly. It's becoming more and more telephone. And I'm highly privileged to be among great chaplains over here at Good Shepherd Hospice. They are really incredible chaplains in the sense they know what they're doing, they're experienced, and they've got a lot of compassion and skills to serve people where they are, no matter what the situation is.
Now, have you been adapting to the technology side of it a little more, doing some visits, via the phone or FaceTime or Zoom?
Well, of course, the age barrier for folks that are not used to what we're doing right now with Zoom, even with FaceTime. And so those are the challenges. But, it's amazing, even with a phone call, how you can connect with folks. My first time ever doing this, I went to FaceTime with one of my patients. Has a lot of Parkinson's and is progressing into dementia. And there he was laying in his bed, having just woke up a little while earlier with this big pillow. And the first thing he said was, "We look alike." I said, "I'm going to see my doctor right after this call," and so forth. But it worked well. It just worked as well as if I was sitting in his living room like I normally do. And so these tools are very powerful. And our chaplains are so creative, and actually they're brilliant, but they do different things. Some of them sing on their visits that have musical talent. Don't even ask for that, Pat. I have none. But they're able to play a guitar and sing, and it's amazing what that does for patients and their families, even though the chaplain's not even in the house. It's a beautiful thing.
So do you think it's a different type of spiritual connection when you're not able to be there physically next to the patient?
That's a great question, and one we don't have time to answer completely, I don't think. You would expect somebody like me to bring this word up somewhere. I think prayer has to be a part before you even make the call. Mm-hmm. That maybe we're depending on somebody bigger than we are to make a connection. And then obviously prayer with the patient and family if they so desire, without overdoing that term. I think we have to work a little harder at it because just with looking at a phone, you're not always going to connect with the eyes and the voice of someone or even their manners of their bodily movements. And we're trained to do that. So it's just something to get used to. It's kind of like myself. Getting used to speaking, as I told you before, in 2 different churches on Facebook and online with no one there except a camera. It's a little different, but I'm just grateful we have this opportunity, really. And the families and the patients seem to be blessed by it, and that's the main issue.
What would you say to a patient or maybe one of their family members that is a little unsure about, getting technology involved in these type of visits?
Well, for me, that'd be pretty easy. I just confess my own reluctance to ever join the crowd on Facebook. I'm 6 weeks into this, so now all of Chapter's Help's laughing at me. I got enough things going on in my life to know what somebody ate for supper or where they're going tomorrow, unless it's important. But it is an incredible tool. I could tell you a story out of my church that illustrates exactly what we're trying to do here, that we wouldn't be able to do if we didn't have Zoom and FaceTime. I got a text from a lady in my church that said we're international now, and I'm a small church, very small, because I'm full-time with Good Shepherd, and said we are, and named the country, which I'm not going to name, and mention two people's names first and last. One of them has beginning progressive dementia, and the other one has end stages of Lou Gehrig's disease, which is one of my least favorite of all of the diseases we encounter. And she asked them if they wanted to watch. They don't know each other. They're in different cities in a different country. And the Lou Gehrig's patient responded on phone, unable to say all the words, about how that was really going to help him and how much hope he received from that, and how this was going to be part of his journey in his final days. That is exactly what we're doing with this in chaplain care. And it is as I felt that day, it is one of the most humbling realities I've ever had in my life, to know that that was being done. And it's all because of technology and then the opportunities to do it. And so, and I say this often to our chaplains, but I say it to myself, having been doing this a long time. We seldom ever really know what's being completed and done in someone's life, but there are things being done and completed in people's life and helping them. The thing about a phone is you don't feel that and sense it as much as you would in person. So I guess you have to take it by the famous word. You have to take it by faith. Something good's happening. But like I said, we got great chaplains that I marvel at what they do with their families and patients. So it's a very good thing. I'm glad we have it.
All right. Well, it sounds like you guys are having a lot of success with that. And Charles, thank you so much for taking the time for joining me today. And everybody watching at home, thanks again for joining us, and we will see you next week.